At the beginning, I was a little bit naive to what was going on with myself and my body. I was not paying attention and listening to what my body was telling me. I would walk, I would get short of breath, having difficulties running and playing with my daughter, basically doing my daily activities. I was having trouble with that. But then it was a rude awakening when I was having problems with my heart and having irregular heartbeats, and I was diagnosed with prediabetes. That was a shock to me because I want to be around for my daughter, you know, and my husband. I want to have a healthy life with them.
In this case, with your wheat thins, it says on the front 100% whole grain.
I started going to the Heart and Vascular Institute on February 4th, 2016, where I met Megan.
So for all of my patients that are referred to me, we follow the Mediterranean diet. So that's based on lean proteins, low-fat dairy, whole grains, fruits and vegetables. So I created a meal plan for her that included breakfast, a snack, lunch, a snack, and dinner. And it showed her examples of what she could do, and I provided recipes as well.
So the first thing I would say that I changed was being able to read labels and making sure that I was having my 3 meals a day and my 2 snacks, because I would just eat like 1 or 2 meals a day, not healthy meals, you know, and just call it a day. But now I have to, I think about what I'm going to eat, making sure that I'm getting my vegetables, my protein, and some carbs here and there, but just making sure I have those 3 meals and those 2 snacks. And then also the other big thing is, you know, I eliminated some of my sugars, eliminated the alcohol, and then also the biggest thing was exercising. You could not get me to exercise whatsoever, but now that it's like second nature. If I miss a day and I don't exercise, I'm just thrown off my routine. I always wanted to run. I'm like, oh, I'm a big girl, I can't run, you know, and it was like those misconceptions, if you're heavy, you can't run. But that's one thing I set myself that I wanted to do, small little goals. So what I started to do, I was like, oh, let me run 30 seconds, let me run a minute. I started pushing myself up and increasing the time till where now that I run 5Ks. I know it's short, but you know, 5Ks, I'm able to run 4.5 miles on a daily basis. In total, I've lost 80.4 pounds. My heart condition, I don't feel the irregularities in my heart anymore, so I don't feel that skipping of the beat. So I'm happy with that. And my diabetes is controlled, so which is a good thing. When you hit a plateau, don't think that you're going to go back. You know, don't think that you're going to go, like I think myself when I hit a plateau, I'm not going to go back to, you know, weighing the 230 pounds that I was before. This is just a small little roadblock, and you just have to think about, okay, the strategies, how to move forward and keep on going and pushing yourself to go.
She was driven and motivated. She had her daughter to live for and her husband, and she knew that her weight was gradually getting out of control. And when she came to see me, that was her primary focus. And she didn't think that this would happen as a result, but it did. I mean, she's doing really, really well.
I feel amazing. I feel amazing. I can say that I think this journey that I've gone has not only changed me on the outside, but has changed me on the inside, you know, spiritual, mentally, and physical. So I'm blessed to be able to do this.